CBS 8's Kelly Hessedall joins us live from the County Health Building, where she's learned some new information about those teens. Kelly.
That's right, and we already knew that none of the teenagers were vaccinated, but I just learned from the county that one of them suffered from chronic health issues, but the other two were perfectly healthy.
The cases were, fairly rapid in their progression. So they started out with, what looked like regular flu infections. They just progressed and got worse. And so it's really unfortunate, but it is a possibility that that can happen. Like I said, one of the teenagers did have chronic medical conditions that probably put them at greater risk. But it's just a reminder, that flu is something that that is important to be taken seriously.
And that was Dr. Mark Beatty, the Assistant Medical Director in Epidemiology and Immunization Services at the county. So why is this flu season so bad? A doctor at Rady Children's Hospital says they are seeing a surge in flu patients. They're seeing double the number than average and double the number of hospitalizations. She says the reason behind it could be a number of things. A more severe strain of flu possibly this year. But the other thing that she mentioned that was really striking is that the number of kids who got the flu shot this year is really low. According to the county, kids ages 5 to 17, only about 20% of them got flu shots this year. Now, some people have said, why do I need to get a flu shot? I've gotten one before and somehow still got the flu. Here's what Dr. Alice Pong at Rady's told me.
So a lot of people think that, oh, I got the flu vaccine and I still got the flu. It's not a perfect vaccine. It's not designed to completely protect you from getting infected. This is very similar to what we told people about COVID vaccine. It's not necessarily going to prevent you from getting infection, but it will help prevent you from getting really sick. It can prevent you from getting a lot of the complications.
And among the complications she talked about was that flu can develop into really bad pneumonia, which can also develop into a bad secondary bacterial pneumonia, which she said sometimes can affect your heart. It can also affect your brain. So, it's some really scary stuff. The bottom line, she says, get your flu shot if you haven't done so already. So far this flu season, 73 San Diegans have died, and the county says none of them were vaccinated. Carlo and Shannon.
Kelly, not perfect is something I think most people understand. Vaccines aren't perfect, but it's still a little alarming. What do we know about the effectiveness of this year's flu vaccine?
Yeah, we won't know for sure the effectiveness until the entire flu season is over. Again, we're about halfway through. Some reports out there, however, suggest that this year's flu shot is less effective than last year's. Last year's, according to the CDC, was around 41 to 44%. But yes, vaccines aren't perfect, but as you heard the doctor talk about, they're really aimed at preventing, severe illness or hospitalization or even death.
All right, some good information. Thanks, Kelly.